Thank you.
We're going to wait just a minute to get started and let other folks join, but the question of the day is actually a prompt, and it is, I always wanted to ... Oh, these are good. You can shout them out too if you want. Sounds like a lot of people are doing what they always wanted to do. What's a Three Sisters vegetable garden?
That's a garden that is a Native American tradition to grow corn for the tall sister, beans that grow up the corn, and squash that shades the soil. And I fail as a vegetable gardener. I can do everything else. I've always wanted to do that kind of garden.
Cool. So the question of the day is, I always wanted to ... I love these. Thanks for answering. We have another fun thing happening today. But before we talk about that and get into our agenda, I want to welcome you to the Friday call. And now I am going to turn it over to Mary Smith from Maddie's Fund.
Thanks, Kristen. Thanks, Bobby. Thanks, everybody. And mostly I want to thank the association for just a kick-ass conference the last couple of days. I really felt like I was rejuvenated, inspired, and was able to sort of renew a commitment to let's really look forward and let's do things differently. So I've been thinking a lot about this thing. You know, we use acronyms all the time. We just do. And acronyms are like a secret language. And the thing about a secret language is some people know it and some people don't. So there have been times over the past 2 years when people have been sort of confused about, oh, diversity, equity, inclusion. I don't know where to start. I don't know what to do. It's too big. It's too something. And I think one of the things that I've come to recognize is that sometimes those really big things are actually just the illusion, and they're actually made up of very small digestible parts. And one of the small digestible parts of creating a sense of belonging is when we stop using a secret language and use a language where people can feel like they're a part of something. And so when you think about TNR, most people don't know what TNR is. And so when you explain it, it gives them a much easier way of understanding. And I don't mean explain by saying trap, neuter, return. I mean, actually explaining. And you have to realize, you guys, I'm the person who is often saying too long, didn't read. And I'm not a fan of using words, more words, but I think this is one time when using more words makes it possible for people to feel part of something. And that even goes for Haas, because when we use those initials, we make it sound as though it's something that just started 2 years ago. But to be honest with you guys, the roots of human animal support services are, probably started a decade ago. And so when we take the time to explain things, I think it helps people understand more about what we do. and makes them feel in a small way that they're part of it. So that's my plug to use more words, which is so not me, but what the hell? So much is not me anymore. So have a great weekend. I'm out.
Thanks so much, Mary. We were just talking about that in the context of HOS, because human animal support services is simply a vision for the way we do business. It's not anyone's brand. It's really just a reimagining how we help people and pets. So thanks for sharing that. We're going to move on to our national organization partners who are on the call today and have updates or announcements to make. So over to you all. And remember, if you are from a national org, just jump right in and give us your update.
Hey, I guess I can go first. Michael Bricker from CARE. So this Sunday, we have our first Caregiver Circle national call. It's Sunday at 1 o'clock. This first one's going to be open to everybody. So I would love to see all of you on that call. Again, Sunday at 1 o'clock. I know everybody's busy the holidays, but we're going to have some awesome news. Some prizes. It's going to be really, really cool. So Sunday, 1 o'clock on CARE's Facebook page. Again, the first couple are going to be open to everybody, but then after that, you have to be in the circle to get these calls. So join the circle today. It's text circle to 52886. Thank you all. Have a great call.
Hi, everyone. Dr. Pisano from Team Shelter Million Cat Challenge. I just wanted to alert everybody to the link Allison put in the chat about feline testing, that webinar. It's really important because as we help shelters, we're finding amazing cost savings and just ways that we were doing things so much differently before. And so it's not only better for our population, but for our budgets too. So I encourage you all to attend that webinar or listen to the recording.
Hi everyone, Lisa Martin Garlic here from Good Pup. Either myself or Allie are usually attending these calls, but I just wanted to say hi. And we love these calls because we love to stay attuned to kind of what's going on in the ecosystem so that we can better tailor our products to you guys and how we can make Good Pup training more accessible for your folks. So if you have any questions, I'm on here or Allie Mayer. We had our webinar last night regarding positive reinforcement training and myths associated with it. So I'll be sending out an update about a recording that you guys can watch if you weren't able to attend, and we will have an update on our next webinar in January. Thanks.
Hi, this is Dr. Sheila Segerson from Maddie's Fund. Just want to let everyone know that we're going to be having a survey going out next week to try to learn about everyone's behavior programs in the organizations that you work for. So whether organizations have a really strong program or not much at all, we're looking to learn about what's going on. So please stay tuned for that.
And next week, Human Animal Support Services is hosting a webinar. It's called Coming Together to Accomplish More: Coalition Building for Animal Care Organizations. And this is going to be led by Catherine Shinar and Shelley Moore, two totally amazing people. So we're really excited, and folks that have a lot of experience building coalition and animal welfare. So that's next Thursday. I shared the registration link in the chat.
And Kristen, I did wanted this is Brent from Best Friends, wanted to mention, we talked about it quite a bit last week about length of stay with what Steve Zeidman from Pet Health had presented. And so Dr. Hurley's presentation webinar went out last night. I can't find it on the Best Friends website, but I did find a YouTube link that I'll post in there for folks that may have missed it. But it's definitely worth checking out because I know a lot of people are struggling with length of stay right now.
Okay, great. Now it's time for the second fun thing of today. So first of all, if you didn't answer the question of the day and weren't with us, it is, I always wanted to blank. So we had some really cool answers already, but if you haven't answered, please do. And The second thing is we asked you to wear your favorite animal welfare t-shirt and to share it with us today. And if you wanted to bring a link to tell folks how to buy it. So I'm wearing mine, which is the Lifeline's Pride shirt. It's so cute. It is from Lifeline in Atlanta. So I'll share the link to where you can buy that. But who else wants to share their favorite t-shirt that they're wearing today?
I will. I'm also wearing a Pride one. This one is from Pinups for Pit Bulls, and it says "Love knows no breed."
Share.
Okay, go ahead. Go ahead.
I'm wearing I'm a Mutt. You can see all the mutts. It's from Marley's Mutts in Central Valley, California, and I'll put the link in the chat.
Okay, I didn't know about the wear your favorite animal shelter or rescue, but I'm wearing a UWM, University of Wisconsin-Madison, sorry for the acronym, sweatshirt. And on the back it says Flamingo Security, because they have a fundraiser that like we have to protect the flamingos. I was a security guard for them once and protecting their little plastic flamingos on the hill. You can ask me about it later if you're curious.
Hi, I'm wearing my Furry Scurry shirt from 2007. If anybody's here from Denver, they know that we weren't allowed to use that name after 2007. So this is sort of a relic that I pulled out just for today. I don't have cool shirts like everybody else, but this is meaningful to me because I thought I came up with a catchy name, and then I realized that it had already been used and trademarked. So that's my message for today.
I didn't know either that it was supposed to be a favorite shirt day, but I actually am wearing one of mine. It's Best Friends with, but it's about a better world through kindness to animals.
So I've got on Adoption is Cool, and I invite all of you to visit our site at Zazzle. It's already in the chat. As I said earlier, we unabashedly think we got the best graphic artist in the world, and she did a great job this year coming up with some new designs for us. So we'd love to have you take a look.
I have on my I Foster, I Save Lives at Casey Pet Project shirt.
Hi there, this is Shannon at Heaven on Earth in North Hollywood, and I have on Support Your Local Cat Rescue for the cat people. They can be purchased at heavenlypets.org.
All right, thank you all. Well, we have a packed agenda, so we're going to move on, and thank you for wearing your shirts. They're all so cute. We are going to start with Dr. Segerson, who is joining us today to talk about the revolution in the Dunbar bite scale and the working group that she's been chairing and sort of the work we're up to and what you can expect is coming. So Dr. Segerson, over to you.
Thank you, Kristen. I'm going to go ahead and share my screen. And I'm going to start by saying that I am not wearing an animal welfare shirt this morning. I was happy just to get out of my pajamas this morning and into some other clothes, but I really enjoyed seeing everybody else's shirts. I'm going to be talking a bit about what Kristen just told you, our dog bite assessment working group and what we've been working on. This group started about a year ago now, and we've had a core group of people involved from the start. New people join, one person go away over time, but you can see the names on the screen of the people who've been involved in this group from all fields: animal welfare, veterinary behaviorists, the animal behavior world that is not veterinary behavior. So a broad representation of different types of groups and people involved in this working group that I'm going to talk about. But back up and talk about dog bites. When we think about dog bites, usually we're thinking about this, a big dog inflicting serious damage. And before I talk about this topic, I always want to point out, I don't know how many of you have seen this book, Dogs Bite by the amazing Janice Bradley, that talks about how serious in detail about how serious dog bites are very, very rare. And you're much more likely to have a lot of other things that you would think are really uncommon happen than to be bit significantly by a dog. So just want to put things in perspective because this is a very heavy topic, but reminding us that for the most part, our dogs are just our wonderful companions, as we know. This was a paper that came out a while ago now, but I want to highlight this bottom section. And so there was an original paper about fatal dogs attacks that spurred a lot of discussion. And then this paper specifically highlighted that if we want to prevent dog bite related deaths and injury, we need public education about responsible ownership, dog bite prevention, stronger laws, better resources for enforcement of laws, and better reporting of bites. And so that is one of the big reasons why we started talking about this project. Hopefully most of you are familiar with Dr. Ian Dunbar's dog bite scale. This is what the tool that is most commonly used in animal sheltering to assess the severity of dog bites. It's important to acknowledge that this scale is focused on wound pathology. So it's focused on one factor, and the bites can range from level 1, which level 1, there's not even any skin contact from the teeth, to level 6, where the victim is dead. And so Dr. Ian Dunbar developed this based on his background and experience. There wasn't research. There's lots of personal experience that went into the development of this scale, but not research behind it, although this scale has been used in research projects more recently, most notably Calgary in the past couple of years. So Ian Dunbar developed this scale, and then he made recommendations based on the scale, saying that the level 1 and 2 bites, which aren't even breaking the skin, compromise 99% of all dog incidents. And these higher level are where we're talking about more danger, especially level as we're getting in between levels 3 and 4 and up to level 4. And in talking to Ian Dunbar, he recognizes that this scale would benefit from a little more clarity in between that 3 and 4 zone where we're trying to decide the seriousness of a dog bite. And so we talked to Dr. Dunbar about it. We talked within our working group about it. And then we started with an initial survey that some of you may have responded to, asking people to tell us about what dog bite scale they use and any challenges they have with it or what they love about it. So we got responses from a lot of people. Most people had lots of experience working with or investigating dogs with bite history, so more than 10 years. And this list on the screen is the list of factors that our respondents identified. There are about 95 respondents. The important factors when making a determination of risk or dangerousness of a dog. So you can see all the items there on the screen. And there, we asked about limitations of the Dunbar bite scale amongst those who were using it. About 60% of people were using it. And the big limitations were that there wasn't information on the circumstances of the bite. The depth of the canine is used to assess level, and that's very challenging. And that there was no consideration of other mitigating factors, like whether people were wearing clothing, dog size, things like that. So this is where we started. And from this, we had a long series of meetings to talk about developing a new assessment process for evaluating the seriousness of dog bites. And we are at a place where we do have a tool that we are very close to be ready to sharing, and we'll be looking to some of you to hopefully test it out for us. We'll be sharing that information in the new year and going into detail about what that tool is and how it might be useful to you. And just wanted to give you all a little bit of a teaser today for what to look forward and expect in the new year. Thank you.
Thanks so much, Dr. Segerson. We're going to actually move right on because we have a speaker that has to leave at 10:30. We have Dr. Haraka here to talk about a recent study that came out in Frontiers about restrictions, housing restrictions, pet fees in rental housing. And the results are not entirely a surprise, but disturbing nonetheless. So Dr. Haraka, welcome.
Thanks. Yeah, so real quickly, what I figured I could do is kind of walk you through the paper as if we're all researchers with not nearly enough time. And the way that usually you read a paper, if you don't have enough time for that, is to just go through the figures and any of the main equations. The basic work here was about, let me share my screen real quick, was about taking the top 20 cities in Texas and trying to come up with some way to assess the severity of this issue around pet fees, specifically non-refundable. So we didn't even look at the ones that you can in principle get back. I'm sure that would have made the whole situation even worse, but because as we all know, if you've ever rented, you don't always get it back, even if they say that you should. So what we did is we came up with this metric we called pet fee burden, which is basically pet rent, so monthly reoccurring fees, things you don't get back, times 12 plus pet fees, which are the sort of one-time thing when you sign your lease, divided by the median income of the area for those apartment complexes. We looked at this for all the apartment complexes we could find in the top 20 most populated cities in Texas. We hope to expand this to a national scope pretty soon, but that's sort of the base data and base metric that we were interested in. So basically a higher pet fee burden is a proportion, because I guess in principle, someone could pay more than their total income on pet fees, but we didn't find that was ever the case. So should be something, between 0 and 1. When you look at that, you do find a lot of the relationships you might predict. So this is one of the key relationships that we found, which is that the pet fee burden increases amongst places that are pet friendly and have pet fees, increases the more you have people of color in a particular census area. So the fees are likely discriminatory. That's not an uncommon pattern when things are also linked to income, which was the case here, and also whether or not pet fees were present was linked to income. So it's sort of the same pattern we see in a lot of areas of social justice where income, race, and other factors are all sort of tied together. We're also curious how geography played into it. We looked at all of the different cities in question and picked out situations where there were 2 census tracts that were less than 10 kilometers apart, but had drastically different pet fees as a proportion of rent. To give you a sense, these fees are usually on the order of 3 to 7% of someone's income. So think about that for a second. That's pretty crazy. That means that in addition to having to pay for pet food, veterinary care, toys, leashes, whatever else, on top of all the normal costs of pet ownership, a lot of these places were dealing with up to 7% of a person's income on top of that, just to have the luxury of having a pet in their home. And that's assuming that they just had one. In principle, they could have more, and that would make the situation even worse. So when we looked at this situation where there was geographic inequality and we related that to income inequality, what we find is an interesting pattern in Texas where Austin and Lubbock, which are some of the most unequal cities in Texas, really stand out as outliers. We can actually look at maps of those 2 cities in the context of the pet burden and kind of understand why. Basically, there are these little hotspots where there's a super high burden. And those hotspots are often in downtown areas or near downtown areas where the housing situation is likely about as extreme as it can get within that city. So this is, once again, there's sort of a wrapped up housing insecurity issue that contributes to this, housing prices and gentrification all wrapped up in this. And then lastly, we were interested in just what's the strength of the relationship between this potential racial disparity. So the relationship between how much of a pet fee there is and the proportion of persons of color in an area, and then just income inequality in general, because we know there's plenty of issues with income inequality across Texas. In particular, Houston here stood out as a significant one. Houston has a really unfortunate history around redlining and other issues that exacerbate inequality. And then when you look at that on a map, you kind of see, and it's a less obvious pattern because there's no one little hotspot. But what you end up seeing is this sort of projection of regions to the northwest, which is actually where the most severe redlining was happening in Houston historically. And so whether or not that's related or it's just a compounding effect is hard to say. The overall story here, though, I think, is that, as Kristen was saying, sort of unsurprisingly, but very unfortunately, there's a clear sort of but complex relationship between income inequality, racial disparities, and the presence of pet fees creating an additional burden on people with lower income and people in regions with more persons of color, census tracts with more persons of color. And so the big takeaway here is we really, I think, are starting to have evidence enough that we can start pushing to do away with these sorts of fees altogether and take away that one extra barrier to pet ownership within these populations and just in general. And that there are actually, if you read the paper, there are actually some areas that are already kind of on their way to doing this. California doesn't allow sort of random fees like that in general. And so we have some templates in some states that we might be able to use to address this. But we should really get rid of these fees altogether because they're doing no one any favors and they're sort of just money grabbing. Let me see, there's a question in the chat. We're not clear on who the landlords are in these situations. One of the follow-ups we want to do is specifically look at places that are subsidized by the government. So subsidized housing is not always landlords that are huge or landlords that are small, but the fact that government funds are going to it makes it a little easier to get the government interested, because if their funds are going to basically a really kind of crappy, unethical policy like pet fees, then maybe we can use that as leverage to convince them to make policies against it. Yes, there is a link in the study to the California laws. I'm not the policy person, so I apologize in advance if I misquoted the policy stuff. We had Lauren Looney on the paper who wrote all the policy sections, and happy to get you in touch with her if you have specific questions on that. Awesome. Thanks, everyone.
Okay. Thanks, Kevin. Thanks so much for being here, and thanks for your time. Really appreciate you you sharing that information.
Yeah, happy to do it.
Great. Okay, we are about to move on to our next speakers, but before we do, just want to ask, 2022, we're hoping to get some amazing guest hosts to host their own call. So if you sit here every week and you think, I have such a great idea for a call, I would love to host one. We are hoping you will fill out this brief form and let Bobby Mann and I help you set up a call. So we're looking for guest hosts for 2022, at least once a month. And we would love to have any of you fill out the form. If you're thinking, I don't have time to fill out this form, but I still want to host a call, email us. We're pretty committed to helping any of you set that up. These are our calls. They belong to all of us. And so we're hoping for lots of folks to be interested in helping to host. And if you feel a little bit nervous about it, don't fear. Bobby or I can co-host with you, or we can help you set up the call so it'll be easy breezy. It can be intimidating to host with 200 or more people, but you can do it. And we want to see you shine. So we put the form in the chat. I want to welcome our third and final topic of the day. We have Heidi Marston from Los Angeles Homeless Services Authority, Annette Ramirez from Los Angeles City Animal Services, and Allison Cardona from the County of Los Angeles Department of Animal Services, all here to talk about a truly incredible collaboration happening in Los Angeles that we all can learn from. So welcome to all three of you, and thank you so much for being here today. I'll turn it over to you.
Thank you. Thanks so much for having me. And Bobby, I don't know if there's anything you wanted to say or you want me to just hop in.
No, I'm excited to
Okay.
watch the show. Thanks, Heidi.
Okay, awesome. Well, thank you all for having us. We're super excited to be here. I'm going to go through a couple of brief slides just to kind of frame it and then turn it over to my awesome colleagues in the city and the county. But just wanted to kick off by saying, I'm sure some of you are wondering why we're starting off with a presentation about homelessness. And I think there's a lot of reasons, but one thing that we've really seen in LA is there's a lot of parallels in the systems around animal welfare and in homelessness, not only as it relates to people who are unhoused, who have pets, and how we think about that and keep those entities or family units together, but about how both in a homelessness system and in an animal welfare system, it's really this scarcity model that we depend on, a charity model, a model that uses people who are passionate about the work, but really don't go into the work to make money. No one goes into animal welfare, I would assume, or into homeless services to get wealthy, but you do it because you're passionate about it. And so we've all started talking in LA about all of the parallels and things we can learn from each other, and then has brought us to ways that we can collaborate together. So if it's possible, do you want me to pull up the slide deck, or would you like?
Yeah, Heidi, help yourself. You should have access.
Okay, awesome. I will do that. Okay, give me 1 second. All right, so I'm just going to kick it off with some framing, and then we'll go into the group discussion. So if you can see my screen, awesome. Okay, so just a couple things about homelessness and the homelessness system. And for background, Los Angeles Homeless Services Authority, LAHSA, and I appreciated the discussion earlier about acronyms. We go by LAHSA. We are a joint powers between the city and the county of LA, and our organization's role is to lead the homeless services response system and to coordinate LA's response to homelessness. Which is a big scope, but we do it all in collaboration. So a couple things I wanted to frame out about homeless services before we get started. And so the first piece I really like to share with folks is that being unhoused in America is not a character flaw or an individual shortcoming. It's really a grave system and policy failure. And we can see over time exactly why that is and how we've gotten here today. So I want to give you a little bit of that background in this presentation. I'm going to go back here. So one way that I like to think about this, and I know you all understand because you work in these systems every day, but it's this idea that systems are perfectly designed to get the results that they get. So if we don't like the results we're seeing, whether it's homelessness or anything else, we need to change the system that's creating it. And what I use as a metaphor, and my team helped me come up with this, are these shadow monsters, because shadow monsters, like you see here, are these very elusive. They're these things that kind of linger in the background. They're hard to pin down and hard to see, but they are truly the things that are causing the issues that we have today. And it's very similar to like healthcare, for example. So homelessness in particular is really a symptom of these shadow monsters, if you will. They're a symptom of racial and social and economic injustices that have perpetuated in our country. Just like a disease, if we have a disease and we go to the doctor, it wouldn't make sense to just treat our symptoms. We need to treat the underlying conditions so that we have a better path forward. And so it's no different in the case of homelessness. So just a little bit of framing for you and what we're talking about. So about 568,000 people are experiencing homelessness across the country. And just for comparison, that's about the size of Washington, D.C. or the city of Milwaukee from a population perspective. We do a census count of unhoused individuals every year. This is based on 2020. COVID interrupted our census, but we'll be doing another one this year. And of those 568,000, about 151,000 are in California alone, and 66,000 are in LA County. So about 1 in 4 are in LA County, which creates a very real crisis here, not only because of the numbers, but the visibility of homelessness. And as you can imagine, homelessness continues to be the #1 most political issue because it is so visible across our county. So framing this a little bit and how we got here, the first part, and actually the last speaker was a very great segue, and we're talking about the housing market and ways that this is perpetuating these challenges. But the housing market, whether it's in LA or across the country, is really operating as it was designed to operate. And in LA, this is an op-ed, if you're interested in learning more about it, that Gene Slater did for the LA Times back in September. But it traced back this history of redlining, which really did start in Los Angeles, that intentionally segregated communities of color and communities that had greater poverty into particular pockets. And how that shows up today is those areas are still the areas where we see the greatest concentration of homelessness. So part of our work is thinking about how we undo that and overcome some of those barriers that were put in place when redlining was the common practice. And I'm not going to go through all of this, but I'm putting a few examples here of policies. And my point in putting these down is that we can literally pinpoint the moments in our state's history, the moments in our federal government's history where we saw increases in homelessness. These are some examples of policy choices that were made at the California state level, including disinvestment in mental health services, including cutting what's called a redevelopment fund. So $1 billion a year was going to cities to build new housing that was affordable, and that was cut to zero. Our wages stagnated, which we'll talk more about, mass incarceration. All of these things have directly contributed to the crisis that we see today. And then digging a little bit more into housing, I think it's important to know that there's economics to homelessness, and it's pretty predictable in the sense of income relative to the cost of living. So what we know across the board is when homelessness will increase when the average rent in a community is 22% higher than the average income. And then it goes up even more when it's 32% higher than the average income. In LA, our rent is 46.7% higher than average income. So literally people cannot afford to live. Why is homelessness so complicated? There's certainly no silver bullet, and for every single person that is unhoused, there is a million reasons why and factors that led to it. But this is a photo of Cabrini Green, which is a famous public housing development in Chicago that was torn down. It was then home, back in the 70s, it was home to 15,000 people who were low income. And really post-public housing in America in the 80s, when we started to shift away from the federal government paying for public housing, we saw developments like this getting torn down, areas being gentrified, and these communities really being pushed further and further out into the edges of big cities or into the suburbs. And then we started to see homelessness rise almost immediately after. So federal government stopped investing in housing, which means that the market became a free market and landlords could charge whatever they want to charge for rent. There were no controls on it. And at the same time, the federal government essentially made housing an IRS tax credit, which is odd. So rather than just investing directly into housing development, developers who wanted to build housing had to apply for piecemeal tax credits to try to get their financing for their building, which makes it extraordinarily complicated and expensive and slow. I'm not going to go through this entire slide, but the continuum of care I just wanted to flag. So when we think about how homelessness is funded across the federal government, Housing and Urban Development created these continuum of care models. So what it says is the federal government wants to help fund homeless services, but they don't want to do it directly. So they created a continuum of care, which is essentially a hub in every single community across the US that's in charge of receiving the federal dollars and then putting them out to the charities and the nonprofits that are doing the work. In concept, it was a really good idea. In LA, my organization, LASA, is the holder of those funds, and we administer those funds to our nonprofits. What it also did, though, as a secondary effect, is it took away the federal government's responsibility from addressing the issue, and it really put it on the back of our nonprofits and our charities to not only pay their people hardly anything because the grants are very minimal, but also to rely on fundraising and philanthropy to supplement the cost of homelessness. And so we're starting to see this shift in our country where there's a pushback to the federal government to say, we'll continue to do this work, but we really need a different kind of support from the federal government because the problems we're trying to solve, as we've seen, were ones created by the federal government. So we have to figure out how to reverse those together. So 3 things that we can do to end homelessness or reduce homelessness. The first thing I like to talk about is prevention. So turning off the faucet. So just in LA, for context, in 2020, every single day we housed 205 people. We moved them from the street into permanent housing. They signed the lease. And at the same time, every single day, 225 people became homeless. And we're going to talk a little bit more about this after the presentation, but we're seeing, particularly in homeless services, that turning off the faucet, if you will, is the best way to end homelessness. Because we are never going to be able to keep pace with the inflow. So looking upstream at these systems that are causing people to fall into homelessness becomes paramount. And in fact, while it might seem like a big investment initially, it is always less expensive to keep people housed at all costs than it is to have them enter the homelessness system and cycle through because of all the consequences that come after, which we can talk about. But definitely some parallels there in the spaces in the work to learn about how we really look at prevention and diversion as the #1 intervention. And then just flagging, homelessness is not something that happens overnight. If you think about yourself, if you lost your job and you had to live on your income, how long would it take before you would have to move somewhere? How long could you afford maybe a hotel for yourself without your income? And then if you, worst comes to worst, you end up with no place to live, you can't afford it. How many friends or family could you stay with before you literally had no choice but to stay on the street? So it's a very slow fade that happens over time. And by the time people become homeless, it's every day gets harder and harder to end your homelessness because there's so many barriers that are put in place that you need to overcome. So the second element that we need to do to really end homelessness is rehousing. Seems very easy, but we need to create fast, easy access to housing. There's big debates in LA right now because we have such a large number of people who are living on our sidewalks. Do we invest money in shelters or do we invest our money in housing? And the answer is yes, we do both. But we have to create fast access to housing because at the end of the day, housing is the only thing that ends homelessness. So figuring out how to do that at scale is the important part. And then third seems relatively self-explanatory, but we need housing to move people into in order to house them, right? So across the country, well, I should say in the Western region of the country, there are 30 units that are open for every 100 people who need them. So this basically means it's a really horrible game of musical chairs where the most vulnerable and the most in need miss out because there just isn't enough housing for people to move into. Contrasting that, however, there are 17 million open units across the United States that would essentially allow us to end homelessness in this country 30 times over. However, we can't access those units because they're not affordable, are charging way more than what our voucher system is able to pay at the federal level. So just ending this, want to just share, we can design a system that can end homelessness because we designed the systems that caused it. thinking about homelessness like we think about roads, like we think about infrastructure. It's work that we always need to keep doing. But there is a lot that we can do immediately to really upend the systems that are pushing people into homelessness, to keep them housed and to start moving the trend in the other direction. So with that, I will stop sharing my screen. And I will turn it over to my colleagues.
I'll go ahead and jump in because I'm just, I knew what the presentation was about, but just hearing you, Heidi, I just want to give such kudos to the team that you lead, and the work that you're doing in such a vast system. Just really appreciate it, and the pragmatic way that you explained everything. And you know, I know we were talking a little bit before in preparing for this, just about the parallels. And for me, the first thing that came out was turning off the faucet, you know, and thinking about the parallels to animal welfare. We spend so much time talking about adoption, transport, outcomes, but really turning off the faucet and keeping pets in homes whenever possible. There's just such a strong link there, and how interconnected it is. And I was just thinking too, how much we as an organization have learned from your team at LASA, and just want to encourage other people to become informed. And something that our team was able to do was to get training on how to make referrals to the continuum of care system, the coordinated entry system, so that when we talk to people about their pet, we're also talking to them about what's going on with them. And I'm sure everyone here, you know, housing is, it's either housing or lack of access to veterinary care, but that's what people talk to us about. So knowing a little bit more about the system, and I think first and foremost, understanding that it's not a moral failure and that people have been really pushed into circumstances, is really important.
Allison, I know that you created a slide for us. Would you like me to share that for you?
Sure, that would be great. Thanks, Bobby.
Yeah, of course. Here you go.
And I stole the let's turn off the faucet, Heidi, because I just think it just fits so perfectly for animal welfare as well. And something I just wanted to share is what we've been doing at LA County. What's wonderful is that the county in general is really committed to ending homelessness and has asked all of the different departments, including animal care and control, to really get involved here. And, you know, sometimes it can seem really daunting, like, how do we start? What do we do? But it really is about having conversations with people and finding out what's going on. And Heidi talked about diversion and prevention. These are things that are directly translate to animal welfare. Having conversations with people and finding out, okay, for example, oh, are you staying with a family member? We've found out the family member will allow the dog to stay there if there's a crate and if the dog gets groomed regularly. Great. That is such a low tech solution that we can do. We can donate a crate to you and we can set up, you know, grooming with a volunteer or something else. And if that's going to keep the pet and the person together, let's work on that. But it does take having the conversation. And just, sorry, I think the screen went away. There you go. Thanks, Bobby. Yeah, and this is just some of the things that we're able to offer, but you can start small, and it really is about problem solving. And just, you know, reaching out to your local authority. And I just really have to give a shout out to LASA. They've done an incredible job. We've sent our staff members to be trained with them. We're trained right alongside caseworkers, and it really makes a difference in our everyday interactions with pet owners.
Heidi, speaking of reaching out to your local agencies, I know you talked a bit about the continuum of care. For organizations that are looking to reach out to their local agencies, what's the best method for that?
So I will put a link in the chat. It's a HUD link that talks about the continuum of care lead for every community. Usually it's a government agency or a nonprofit that's the lead, but you can find your community on here and reach out to your lead agency. I'll also put my email in the chat. So if you have trouble finding your continuum of care lead, just reach out to me and I can connect you as well.
Heidi, I guess in animal welfare, we're looking at the numbers and they're looking bad. Things are not looking great. More people are are struggling with pets. Shelters are really full when they typically wouldn't be. What trends are you seeing in homelessness due to COVID, and what are you predicting for spring and summer of next year?
So our annual census is going to take place in January, where we'll get a better idea of what the population looks like. My guess is, one, there's no question that homelessness looks worse on the street, because during COVID, we stopped things like sanitation cleanups and garbage pickup at encampments. And so encampments that were small are now really, really large. And that doesn't necessarily mean there's more people, but it's more visible. So I think we'll see more people inside in shelters. I think we'll see either the same amount, hopefully less people on the street, but it's hard to tell. And one thing I think is really important for us to remember is we all know that COVID is putting a lot of people at risk of eviction, people who can't pay rents because they lost their job or their incomes. And that certainly could have an impact on homelessness, but that impact is not going to be seen for probably 2 or 3 years. I said homelessness is a slow fade. So the people who are going to become homeless because of COVID, it's not going to happen immediately. So in a few years, we really need to keep watching the trends to make sure that we're not seeing these massive inflows of people who have exhausted all of their other options and are left with sleeping outside.
Annette, we want to hear from you too. You have some resources, and you've been with LA City for quite a long time. Can you tell us a little bit about your background and share whatever you would like to share too?
Yeah, actually, I just dropped a resource guide in the chat, which is something that we produce to help our staff when we're having those conversations. We created 2 different types of resource guides. One was a guide to help people who have pets and provide the resources to help them keep their pets. And another one was to provide human resources to connect with human pet food pantries or human shelters to help the person as well. Because one of I think the difficult parts with animal welfare and when we're having these conversations with people is that we oftentimes don't give our staff the tools to be able to address all of the dynamics of the issues that they're being faced with when they're helping the public. So we thought it'd be a great idea to provide or produce a community resource guide that provides a bunch of different organizations, nonprofit, as well as city or government agencies that can provide assistance and help. And one of the things that I wanted to also mention that Allison kind of touched on was that there are a lot of different aspects of homelessness. It could be from someone that's couch surfing to living in their car to living in a tent. So it doesn't necessarily have to be a person that is living on the street. There's a lot of different aspects to homelessness. And there's oftentimes a lot of different options or opportunities that we have as government agencies to provide them with assistance. Like Allison mentioned, providing a crate so that they can, keep their animal housed with them while they're staying with a friend or a family member. So it's kind of like looking at the entire, or having that like further discussion with a person who's struggling to find out exactly what's going on, what their dynamics are, and what simple tools there might be that we can help them. We currently have a case where a gentleman was who's living in his car was having some issues and got placed on a mental evaluation hold by LAPD. So we ended up with his dog. He came into the shelter when he got released from the hospital and created a ruckus. He was throwing things, slamming things around, and he was obviously in distress because we had his dog. He did not have a relationship with us, did not know that we, would be willing to give him back his dog. And initially, staff didn't want to help him. When he finally calmed down, he realized that not only were we going to give him back his dog, there were going to be no charges. We were going to provide him with dog food, and that we were going to follow up with him to see if there was anything else that we could provide him. At the time, we also talked to him about our safety net fostering program to see if we could do anything to help him out, you know, to take care of the dog while he got on his feet. And he wasn't interested in it, which was fine. We sent staff out a week later to where we knew he parked his car, and found him and Sasha, his dog, where his car had now been impounded. So now he is literally living on the street in a tent. So we again talked to him about our safety net fostering program, and he's considering it. So but we had to develop that relationship with him at first, you know, and the initial contact with him was not a friendly or a happy contact, but we've been able to, by talking to him, develop a relationship with him where we now think that he will turn to us for help and assistance when he's ready. And it's sometimes that we do have to build those relationships with our community members, and understand that sometimes they don't come to us with open arms wanting the help. Sometimes it is something that we have to do a little bit of work to break through and be able to provide the help that they really need, and show them that we're here to support them in any way that we can.
Thank you so much. I think we may have time for another question. Before we do, we just want to say next week is the final call of the 2020 year. It's our last Friday call. So it will be a special day around here. We hope you can all attend. And this will mark the second year of COVID calls, which have now turned into something so much more. So we're gonna hope you can be here next week, and then we will have a break for 2 weeks for the winter holidays. We have just a couple of minutes left. So Heidi, is there anything else you want to share? You're probably sitting here thinking, I wish I had said that. And I just want to give you a moment to say anything maybe you missed.
Well, I think one thing that Allison, Annette, and I really wanted to make sure of is just kind of challenging ourselves, because when we all got together, we were like, you know, we know that there's opportunity for collaboration, and how do we start those conversations, and what are the first things that we do? And so we really want to encourage other communities to reach out to your leads and just start a conversation. One, getting to know each other, but then two, talking about these programs and how we could work together. Because we've talked about everything from making sure that our homeless shelters have the resources they need to allow pets no matter what in the shelter, so it's not a barrier for people getting inside, to how can my outreach workers on the street be equipped with microchip scanners or ID tags, so we can start seeing when people have pets, how they're connected. So we have sort of gotten the ball rolling in LA, and I think that there's a ton of opportunity for us, but we really want to encourage others to just reach out and have those conversations too, because I think there's a lot of leveraging of resources that we can do across systems. But Annette or Allison, feel free to jump in too with anything I missed.
Thank you so much. The one thing I just wanted to highlight, I put it in the chat too, and Heidi, you brought it up. It's about removing barriers too, you know, and two things come to mind. One, we just worked with the Department of Health Services. They had someone experiencing homelessness that needed to go into the hospital. He refused to be separated from his dog. So, and Javier Gutierrez was involved. We gave them a crate, and now the dog is staying with the person in the hospital room. It is possible. And then the second thing I want to say is that we have to challenge our own bias and racism. We have another situation where there's a man with his dog, and there has been outrage over this dog and next door comments and Facebook and everything. Not once has anyone asked about the person and how he's doing and if he needs any services in all of these comments. And this is a Black man with a large bully breed dog. So we really have to look at what are we doing and how are we approaching these situations?
Thank you all so much for being here. It's really amazing to hear you talk, and Heidi, just to see those slides too are really, there's just so much parallel to the challenges in animal welfare. So this kind of partnership is so important. Thank you all for being here, and we hope you'll come back and tell us as you progress working together to try to solve for some of this. Hope you had a good time today. I think we covered a lot of ground. We saw some cool t-shirts, and next week we will be back here. We will send out the agenda as early as we can next week, but hope to see you back for our final call. And it's gonna be a little bit of a party. So no downers on our last meeting. We're gonna talk about happy, exciting stuff. So join us next week, and we will see you there. Thanks again to Maddie's Fund for hosting these calls, and thanks to all of you for being here.